Good morning and welcome. We're coming to you live from Rehabilitation Hospital of Indiana. This is a weekly series of courage, hope, attitude, and inspiration. And we want to thank our generous donors and sponsors, Wilson, Kehoe, and Winningham. And today we have three of RHI's own, and it's going to be hosted by Christina Baumgartner, who is our Executive Director of Therapy Operations here at RHI.
Good morning. We have some very exciting news to share related to funding, generous funding from the foundation to certify 43 of our therapists and nurses to become certified brain injury specialists. To help us understand a little bit more about that and the significance of that donation, I'd like to go ahead and introduce Wendy Waldman, who is with RHI's Northwest Brain Injury Center. Wendy? Can you tell us a little bit more about the certification and what this means for our staff, patients, and RHI?
Sure. So my name's Wendy Waldman. I am the Brain Injury Continuum Outreach Manager for the Resource Facilitation Program and for the Rehab Hospital of Indiana, as well as the Vice President of the Brain Injury Association of Indiana. And with me also is Josh Halen. Josh, will you introduce yourself?
Yeah, absolutely. Good morning. I'm Josh Halen. I am the Chief Nursing Officer here and have the privilege to work closely with our brain injury patients on a daily basis. So thanks for joining us this morning.
So I'll go ahead and explain brain injury, the certification that we're now going to be giving the therapists and nurses here. The brain injury certification is run by the Academy of Certified Brain Injury Specialists through the Brain Injury Association of America, and the acronym is ACBIS. What ACBIS is a certification. They offer certifications to both professionals, and now there's a new certification for individuals with brain injury, their family members, their supports, first responders, non-licensed staff. They offer various certifications, so I'm going to tell you about those. The first certification they offer is called Certified Brain Injury Specialist, and what that is recognizing professionals that have worked at least 500 hours with someone with an acquired brain injury, so both traumatic and non-traumatic, to recognize their demonstration of learning and their specialties in regards to many disciplines of brain injury. What that can include would be anything from basic anatomy of the brain to different medical and physical complications to neurobehavioral complications that can occur after brain injury, cognitive, physical, emotional, different kinds of deficits that may happen, as well as then also looking at comorbidities that may exist after brain injury, including connections to substance abuse, mental health, suicidality, which I know is very close to the foundation's heart, different kinds of populations that are more susceptible for brain injury, such as the military, athletes, homelessness, domestic violence, criminals. We look at different kinds of effects that brain injury has on both the individual with brain injury, but also their family, which is obviously very much affected. And then we look at different kinds of interventions, including neuropsychology, speech, cognitive therapy, physical therapy, occupational therapy, recreational therapy, physiatry. Basically, the certification is an overview of all the different disciplines that go into working with someone with an acquired brain injury. It's not just one discipline or 5 discipline job. It's basically, at least 25 disciplines working together because the brain controls everything. The other certification that is available now, which is new through the ACBIS organization, is Brain Injury Fundamentals. And what that is it's a certificate program that's designed to address unique needs and challenges for those that encounter individuals with brain injury. In this case, you don't have to be a professional working with individuals with brain injury. This is, again, as I mentioned earlier, for first responders, for family members, support group leaders, aides, individuals that may want to know a little bit more about brain injury and how best to work with it. It is a little bit less information to learn. So basically, there's a few modules you go into regarding cognition and medication management and building rapport and communication after brain injury and different kinds of ways that families can better cope with brain injury. So now we have the CBIS certification, the ACBIS certificate for fundamentals. And with all of that being said, I am happy to say that since we will have a good number of, a large majority of the professionals here at RHI that work with brain injury certified, once we get through the training and the certification and testing and things like that, we are going to apply for and become one of it will be the first Indiana Brain Injury Alliance through the American certification for brain injury specialists. So an alliance member, there are 15 of them nationally, and basically what that, if we apply for alliance and get that, then we will get it's public recognition to brain injury providers or a designated facility that have achieved the benchmark of having at least 20% of their staff eligible for certified. And with that certification, what that stands for, it will show that we demonstrate understanding of brain injury, the multiple disciplines that work with brain injury, and the entire brain injury systems of care. So we are really excited to become the Indiana ACBIS Alliance member. And with these certifications, it will continue to show the evidence-based and best practices that all of our therapists, nurses, and staff at RHI provides.
So, and I think that's the exciting thing is not only does it just help support our expertise, as we know we've got patients not only coming from across the state, but from other states across the country. And the thing about brain injury is we're touching people at their most intimate moments. You don't wake up one day and say, hey, I want a brain injury. Unfortunately, you've been going through life and something very traumatic has happened to you. And it's very hard to deal with. So being able to offer this certification to help give our staff more support to better understand what our patients are going through, to better understand what our families are going through, is going to make a big difference in the care we provide across the entire continuum. I know from a nursing perspective, I mean, when we go in there and when we work with these patients, we're with them 24 hours a day, 7 days a week while they're here. So it's instrumental in knowing that, you know, it's not the person that's acting out, but it's usually something that's coming from their brain injury, and it's important that we can give our team the tools to help support the patients and their families.
Thanks, Wendy and Josh. I'm going to have Josh go ahead and help us close, but part of that is us being thankful for the foundation and Lisa Thompson Fund.
Yeah, so we do want to continue to thank all of you out there who continue to support RHI, you know, at the main campus and across all of our locations across the state. The work that you're doing to help support us through volunteering, as well as your monetary donations to help support programs like ACBIS, are just instrumental in the care that we provide. We want to specifically thank the Dr. Lisa Thompson Fund for supporting the certification for our staff. It's something, as a somewhat smaller organization, to be able to have a foundation and a fund that can really come through to help get the education that we need to provide the care for our patients is instrumental. And you're not just impacting people when they're in the hospital, but you're impacting them for years and years down the road. Just last week, I got a letter in the mail from a family member, and that letter was celebrating their 1-year anniversary from graduating from RHI, and they were just so thankful for the care that we were able to provide here, and just how that we had become part of their family throughout this journey. So thank you so much for your donations. Thank you so much for tuning in. We're just grateful to have you all on our team.